Welcome to my channel. Hi guys, welcome back to our YouTube channel. It's your girl Martha Friends. As you can see by the title of today's video, we are going to talk about family planning and female birth controls. So we have several female birth controls, but before I get into it, I want to define or make you understand what is family planning. Well, whether you are sexually active or not, married or not married, you might need or you will need this at a point in time because you don't want to just keep giving birth, giving birth. So family planning is a method in which, it guides you to plan your kids. When is your next child, the spacing between your kids and all that. That's why it's called family planning. Well, it's a decision that you can make on your own as a female, or you can make it as a couple with your male, as a couple with a male. We also have for male, but I won't get into male one. I'll just talk about the female birth controls. So we have several. I have a few here. I'll show them to you and explain those that are currently that I have here. So we have the ring, we have the IUD, we have the implant, we have the 28-day pill, and then we also have the injection. So these are the differences. The injection. I also, some condoms, because not everybody. Condoms are also, a female birth control. The IUD. Then this is the implant. Let me just bring it closer so you see. And then there's the IUD, condoms, and the injection. And then this is just, male condoms. This is female condoms. So I'll start with the IUD and the implant. So both of them, the implant, we put it under your arm, either left or right, just under your skin here. It's for 3 years and for 5 years. The IUD goes in your uterus or in the cervix, like goes through your vagina. That's where it goes, and then they push it in your uterus. It's also for 3 years. This is for 3 years. And so their side effects are you can bleed depending on your body and your immune system. Different women react to it differently, but for both of them, all birth controls have similar or more or less the same side effects. So you can bleed, it can, only when it's severe you go to the doctor to, you go to your gynae to see, but then it can just be light bleeding, sporting. You can start immediately when you have it. You can start for the first 6 months or maybe 3 months, or you may not bleed at all. That's absolutely normal. And then like for this, when they put it under your arm, they just create a little bruise, so it heals. It's not that big, and you won't feel pain or anything, because then they will inject it and all that, so they'll numb it. You won't be able to feel any pain. And so they put it in, and then they plaster it and all that. Then you can so once they put it in, it becomes effective from 7 days. That's when it starts being effective. So all the female birth controls, they don't protect you from STDs, so you still gotta use condoms. You still gotta use condoms, whether it's a female condom or it's a male condom. They only protect you from pregnancy, but there's always that 99.9%. So you get this at your gynae. Then once you put it in, that's it. You don't have to come back for it. It's not like the injection or the pills, which I don't have them here. The pills and let me start with the pills. The pills is 28-day pills, so you take it every day at the same time. Make sure you don't mix up the times, because it's only effective if you take it in order and at the same time. The injection, you get it at your gluteus maximus, that's your butt, and then so you come to the gynae, they inject it, and then you come back after every 3 months. So if you say, let's say today is the 10th, so you come you came on the 10th, so wait for 3 months, you come back on the 10th of the last month to get it. So with this, you keep coming back. And then also with the pills, you keep coming back for a refill. It's not like the IUD or the implant. Once you have the implant or the IUD, once it's in. Only when it expires, that's when it has reached its 5th year, or if it was for the 3rd year, that's when you come and then they remove it. So you can't keep it in your body, because then it might cause infections, and it also won't be effective and all that. So other side effects can be like a little nausea, headache, all the side effects that you'll experience, let's say when your periods are about coming, you know, that backache, you're feeling nauseous, you feel like, you know, you have a headache, you're kind of like moody and cravings and all that, you know, those are like the side effects that are also associated with the birth control. However, as I said, and this is very important to note, it does not protect you from STIs, STDs. It doesn't protect you from syphilis, gonorrhea, HIV and AIDS, and all the STIs out there. Make sure you use a condom, make sure you condomize, and I'll say it again, make sure you use a condom. And before putting it on, it's important to, you know, inform your doctor if you probably had unprotected sex, so that they can just do a pregnancy test and make sure they put it on. If you'd ask me what would I recommend, well, it depends on you. If you are able to keep up with taking the pill every day at the same time, good for you. If you don't probably like cuts through your body, it's not going to be a big cut, it's just like a small cut, or you don't like injections, or you can go for the IOD or the implant. It all depends on you and then the best method for you to use. However, as I say, there's always that 1%. It's, you know, 99.9 effective. Yes, so far I haven't heard of anyone who fell pregnant while they were on the implant or the IOD, but I've heard of a few that got pregnant when they got the injection or the 28-day pill. That's basically because they missed up their times, you know, or they skipped a day, and then yeah, it won't be effective in that way. So I hope this video was educational enough. I hope you'd make the right choice, whether it's you're sexually active or not, because even if you're married or not married, you wouldn't want to give, you know, keep giving birth, you know, all the time, or you would want to plan your kids and space up, you know, based also on your finances, based on if you can afford, you know. Don't just keep popping babies and popping babies. And yeah, hope you enjoyed this video. Make sure you like, leave a comment, and see you in my next video. Bye.